As someone who has lived in Greensboro for many, many years, and as someone who has been a part of the advocacy framework in North Carolina in many different incarnations, one of the things that's missing locally is the idea of community support in terms of a space that folks can kind of go and kind of figure things out from the beginning. So whether it's drop-in centers, whether it's a place that folks can go during crisis while a family member is receiving services, that loved ones can actually go and learn about what this diagnosis stuff means and what does mental illness and behavioral health even look like, because it's really overwhelming, and the alphabet soup can be all-consuming to most folks whenever they first experience it. So what I have seen in my time of being with NAMI and being in Raleigh again is the idea that there's a commitment at the state level and locally to change the conversation. And we change that conversation by stopping the silence and stopping the stigma, by coming together and having dialogue. So one of the things I appreciate about the local community, especially here, is that in Greensboro, we are known for having small conversations in small places that then get bigger, right? We're the seat of the sit-in movement. We are a place where there's lots of academic conversations going on through our institutions of higher education. We're also a community that's committed to social change and social justice. What I'd like to see is that go statewide. I want to see that from Murphy to Manteo, because the inconsistencies in our state of having access to conversations, access to care, access to across the board is really where our big sort of gap is right now. And that can't be solved by one group. That can't be solved by NAMI alone. It can't be solved by DOCS alone. It's got to be solved by all of us. And so that's really what I would say would be the thing that I would like to see in the next however long we want to measure it, but that's sort of what my goal is in the role that I'm in now.
Mila, what is mental health first aid, and how best can we implement it and expand it in Greensboro?
Thank you. Mental health first aid is a 5-step action plan that we offer here in the community, and it's something that represents...
A little closer to the mic, please.
It's a 5-step action plan that we actually offer here in the community, and I was so glad to hear Mr. Barber talk about it earlier. It actually teaches members of the community, members of the faith community, business people, to actually recognize symptoms and signs of people who may be experiencing mental health distress. And it teaches you how to appropriately and compassionately respond to people who may be experiencing crisis. So many times we see somebody in crisis and we go, yeah, I'm not touching that because that looks really icky and I don't have a clue what to do and I do not want to get involved. Whereas if we saw somebody about to go into labor, we'd say, oh, what can I do? Can I help you? Because we get excited about babies being born. Or if somebody was having a heart attack, we'd say, oh, do you need me to call 911? If somebody starts hyperventilating or somebody starts walking in circles and talking to people that we can't see, and we're like, yeah, not me. And we back up, and we further stigmatize the person. So if we knew what to do, if we weren't afraid to say, you seem to be in distress, what can I do that would be helpful to you in this moment? Can I call somebody for you? Can I just sit and be with you in this moment? It teaches you how to recognize. Of course, first you're going to make sure that they're not, homicidal, if there's no signs of danger to you or to them immediately. But after that, if you can practice the ministry of silence, is what I call it, and just let them know you see them and you're not ashamed and you're willing to be there in the moment. So it's a really great 5-step action plan, kind of like airway breathing circulation that you learn in basic CPR. It's a 5-step mnemonic, and anybody can do it. And you'll find yourself using it in your faith community, in the grocery store, at your family reunion, in your place of business. You'll find yourself using it anywhere. And I do just want to say, we're very fortunate here in Guilford County that we have a lot of resources. We have classes that we happen to teach, and everything we do at MHAG is free. We teach people strategies on how to manage their own symptoms. And we're a peer-run organization. So we appreciate the therapeutic community, we appreciate the pastoral community, but a lot like AA, we use certified peer support specialists who can say, you know what? I've been manic, so I understand what you're experiencing right now, and here's what I do when I'm feeling really manic, and this has worked for me. We don't tell people what they should do. We don't should all over anybody. Hear what I said and not what I didn't say, okay? But we help people figure out what might be helpful to them in a crisis, and they realize, oh my gosh, you really do understand, and that's the kind of help that can work.
When you offer all these different courses and items, are you just so flooded with people signing up that you don't know what to do, or can you handle much greater capacity? Should people fear calling in and missing the next class because you're just overwhelmed?
We can handle more people in our classes and our support groups. What we're a little strapped for right now is the one-on-one peer support. We offer about 4 months of one-on-one peer mentoring, and there's a bit of a waiting list for that one-on-one peer mentoring right now. But classes, we've got plenty of space in our classes. We offer 10 classes a week, and they include RAP, Wellness Recovery Action Planning. Our morning classes are all evidence-based, best practice, and our afternoon classes are fun things like art, creative writing, food for wellness. Those are more fun things, lighter fare, that are kind of a reward for doing the hard work that they do in the morning. And we've got a table out front. I'm not going to bore you with all kinds of details. I didn't come here to sell our services. They're free. But we do have a list of resources about other things in the community, and some of them are faith-based, and they complement the therapeutic elements that we refer people to, because we do believe that the two are necessary and they complement one another.
And if we could add anything to the menu, is there something you wish Mental Health Association or Greensboro itself did or offered to make mental health services even better in Greensboro?
I would love to see a peer-run respite center. Winston-Salem just started one. The news came out last week on the 8th. However, they don't want to have anything to do with any state funding or state regulations, so they just want peers to run it because they don't want any red tape. I would like to see some regulations. I would like it to be staffed by, I'd love to see one here in Greensboro, and we started talking amongst ourselves 4 years ago. I would like it to be staffed by certified peer support specialists who've been trained in mental health first aid and QPR, which is a suicide prevention training. I would like the boundaries to be very clearly spelled out, and I've got some literature that I can share with people afterwards if you're interested. It's not sending people to the hospital when they're in crisis, because the hospital can be a trigger, and we know that. Uniforms can be a trigger, and we know that. And the woman that's starting the Peer Run Center over in Winston was a psychiatric nurse, and her son so wanted to avoid going to the hospital that he killed himself. And so we want to avoid things like that. We want to save lives. So I'd like to see a place where people who recognized that they were symptomatic but knew that they weren't safe in their own home could come and talk to someone who's been there and done that, who could understand where they were in their own heads right now and give them a safe place to de-escalate. And then if they needed to go to the hospital, could go with them and help the medical staff understand, okay, they've got a crisis plan, and when too many people talk to them at once, it revs them up. If one person at a time could ask them for their blood pressure, their temperature, their weight, you know, this is how we could keep them calm while you did the admitting process. So a peer-run respite center could be a great addition to the services here, and they've worked in other places.
And so we need more peer support specialists for that, right?
Yes, and more funding, mental health funding. And I think what Mr. Barber said earlier is mental health funding is one of the first things cut, and mental health needs are always on the rise.
And he thought that the faith community might help with funding in the future. I know churches, synagogues, etc., are not exactly swimming with extra funds, but when you have a purpose, maybe you could do something. You want to expand on that at all?
I think that the church has a powerful voice. The faith community has a powerful voice. And I think the more voices we get, we can all sing together, we can't all talk together, but I think that if we put our voices together at the same time, we can certainly affect change right here in this community. We're a compassionate community, swimming in resources. We don't need to duplicate the wheel. We need to get together and get the wheels all moving in the same direction.
Jack Register with NAMI, do you want to add anything to that?
One of the things I would say to that is we at NAMI provide services that are for families predominantly. When that we have our family-to-family program. We also provide services to consumers as well through our NAMI Connections programs, and this allows folks across the entire family to actually have a space to go. And so like the folks at MHA, we provide services that are free and available. We have 7 different signature programs that we have available through our local affiliates. The key thing is that what we're really talking about is a continuum of care. And we're talking about a continuum of care that meets folks exactly where they are. So if you're the family member who's just learned what's going on, or if you're the consumer yourself and you've just learned what's going on and need a space to go, or if you're the advocate who needs information, what we really need to be able to do is to provide that continuum so that we can help policymakers think about things in a systemic, holistic sort of way. That's the piece that's missing. And I'm sure that the rest of my colleagues would agree that when we have conversations with policymakers, one of the first things we have to do is to go back to the very basics of saying, mental illness is not going away, right? There's no ability for this just to snap our fingers and say that this is gone. This is something that for a lot of people becomes a lifelong adventure, sometimes a lifelong journey that is very difficult, and it becomes difficult because the community cannot respond to help folks be able to get to where they need to go.